Oh, yes.
I'll sit on the others.
Okay.
Perfect. Did you hit
One
record?
happy family.
Yes, I did.
Okay.
Okay, so Aaliyah Kelly.
Katie Green.
Yasmin Martinez.
Nice to meet y'all. And I'm Kelly Farahani, house supervisor at St. David's.
Perfect.
Thank you so much for meeting with us.
Of course.
So I guess question one,
Yeah.
tell us a little bit about your job, like if you
Okay.
had to explain it to someone who knew about nothing about what you did.
Okay. So I graduated nursing school about 8.5 years ago. Started working on the orthopedic unit first, and then I went to what's called float pool. So float pool is where we get floated to all the units in the hospital depending on where the need is. So I show up every morning and they tell me where I'm going to go, whether that be emergency room, ICU, med surge, doesn't matter. I go wherever they need me. I now also do house supervisor, so basically I'm the supervisor of the whole hospital for today. So really the only people above me is like the administration for today. So any kind of issues, concerns comes to me. Any bed placement, patients that come in that need to be admitted, surgical patients, anything like that, I'm in charge of putting them in the beds that they need to go to. And then I'm also in charge of all the staffing, so I have to figure out what nurses are where, if we need more nurses, if we have too many nurses. So I deal with all of that as well. So lots of roles for today. Yeah.
Wow.
Yeah.
Perfect. Where did you go to undergraduate school?
ACC.
Oh, okay.
Yeah.
Perfect. For all 4 years?
Yep.
And then what did you do for graduate school?
I did University of Phoenix online.
Okay.
Yeah.
Oh, very nice.
Yeah.
Okay. How'd you like that?
I liked it. I'm busy. I've got 2 kids at home and busy schedule, so it works for me.
What was your hardest part of schooling?
Probably just the time management. What are y'all all in?
Biology.
Yes.
Okay,
Yeah,
yeah,
natural
yeah.
science,
So you know, school's tough. It takes a lot out of you, and I was working as well. So I think it was just the time management. Trying to get enough time in for studying and getting good grades. I'm still working, so yeah, I'd say that was the biggest challenge.
And
probably.
what kept you motivated through it?
Oh, just the end goal in sight. Even though it's long and hard, whenever you get through it, you have something at the end that you want to do and accomplish. You can just set your mind to it. It's rough in the process. When you get to the other side is when it all evens out. So, yeah.
Good. If you were to tell your 19-year-old self some tips or like do something different, what would it be? If you could go back in time.
Probably just to, I know it sounds kind of like it contradicts, but not to take yourself too seriously.
Yeah.
I think people put a lot of pressure on themselves to, do really good, make straight A's, kind of have this checklist that they have to do. But in the end, if you get it done, that's really all that matters. I don't think that people need to put so much pressure on themselves. Everyone tries to kind of keep up with the Joneses, that saying, and you try to compare yourself to everyone else, but keep your own personal goals in mind, set your own goals for what your future wants to be, and as long as you get there, that's all that matters.
Oh, that's very good. Thank you.
How was your transition from school to actually working?
It's definitely difficult. The real world's different than the book.
Yeah,
tells
Grey's
you.
Anatomy.
Yeah, it's very, very different, but really, you always have to keep learning. Every day I still learn something new, so you just have to be flexible and be willing to be open to new things happening, because you're never going to get to your end goal of being at the top of the leaderboard when you haven't learned from all the experiences you've had in the past. So it's definitely very different though, but that's the good thing about it, is that that's what it's there for. You're supposed to learn, overcome things, and then you kind of move on. So.
Perfect. Did you know you were going to be a nurse from like the very beginning, or did you change your major a couple times?
I actually always did nursing. I honestly don't really know why I chose nursing. I just did. Out of high school, we had like a rotation where we could go to the hospital and shadow doctors and things. So I did that, and then I just stuck with it, and here I am.
Very
Yeah.
nice.
Yeah.
What would you say your favorite thing about being a nurse is?
I'd say nursing is probably the most rewarding job, but it's also the hardest. You see people at their most vulnerable states, and you hold someone's hand when they're dying, and then you can hold someone's hand when they're welcoming like a new baby into the world. So you get to see all aspects. So I think the most rewarding is just getting to be with people in their most like vulnerable times, regardless of what the situation is, for
Yeah,
sure.
knowing that you can like help them. And
Yeah, for sure.
So
Yeah.
obviously nursing is pretty stressful, and like you deal
Stressful.
with a lot
Yeah.
of tough situations. So what's your
Yes.
favorite thing to do to kind of de-stress?
Honestly, it's just taking a break from work. I like to work. I work extra. I work more days than I'm supposed to most weeks. But just remembering that I have to take care of myself and my family first, or else I'm not going to be a good nurse if I don't. So just taking the time off, decompressing, not letting take work home with you. You got to leave it at work. I think that's one of the big things. Just taking the time. Yeah. Do what you need to do.
Yeah. Oh, you can take
Okay,
that.
sorry.
Perfect. Thank you so
Okay.
much.
Hi, it's Kelly. Hey. So, are they, I need to look at the board, are they done or on ortho or not quite yet?
Where we at?
Okay.
How much longer do you want to go?
So yeah, usually, I mean, it's kind of silly, but since y'all have open rooms all the time, you know, anyways, it would be better just to keep 4 rooms blocked, so then Monday we don't have, you know, the hassle of trying to like get people out. So yeah.
The organization.
Oh, yeah. What organizations did you do in college? What are biggest takeaways?
Well, we can see. Well, yeah, we can. That's fine. We can see how it ends today, and then, you know, block however many we need to. If we have like more, great. If not, at least if we keep the 4, I think it should be fine or easier than last week. So, okay, you're welcome. Okay. Sorry.
No, you're fine. You're fine. What is it like being a supervisor and a nurse?
I think it helps because on the days that I'm still a nurse, I kind of see the whole picture.
Yeah.
You know, when you're just a nurse, you only see that side of things. But I think when you're a supervisor, you can bring in all the skills you learn and bring that into your nursing role. So I think it helps. Sometimes it's difficult because you might want to do other things that are not your role for that day.
Yeah.
So you just have to remember, like, separate yourself. But for the most part, I think it helps for sure.
Okay, good. Yeah.
What similarities and differences did you see like between graduate school or like undergraduate and graduate school? Like what was the same, what was different?
I think the same, and just that you're going to school, you're going through the day-to-day motions, you're trying to, let's be honest, get through the next test or, you know, the end of the semester. But I think the big difference is just that one, not only are you getting older, but you're growing and you're maturing as a student too. So I think your mindset's a little bit different with your learning curve, but it's beneficial. I mean, I think you want to be at that higher level when you're in graduate school versus undergraduate. So I think the process is the same, but I think your mind and your outlook are different.
Yeah.
What were your hardest parts about college? Like, was there ever a time where you were just like, is it worth it?
Yeah, I think every person thinks that at some point. 'Cause it's a lot. Some people would rather be doing many other things. I can tell you, being out of it now, it's worth it.
Yeah.
Keep going. Job security. If you ever want to have a family, like you want to be stable enough to provide for your family, you want to pick a job that there's lots of options out there for you, that you can go do different things. So it's definitely worth it. It's hard. It might be, you know, you want to give up multiple times, but yes, keep going. Don't leave. Keep going. All 3 of you, don't give up.
Yes.
Planning not to, but
Oh, yes.
It's hard. It's hard. I get it. Yes.
any other questions?
I'm trying to think.
How is it like working and balancing your outside life, like with your family and stuff? Because I know like some people say like
Yeah.
it's really hard.
It is hard sometimes. I've got 2 younger kids. They're 5 and they're 2.
Oh.
So I work 12-hour shifts. So sometimes I don't even see them very much on the days I work. Like I don't see them when I wake up because I get here so early. And then by the time I get home, we have like maybe like 30 minutes before before they have to go to bed. So it is hard to balance it, but I just have to make sure on my days off that, you know, I'm spending time with them, I'm doing what I need to do to be a mom and to be a wife and all those certain things. It is nice on my end because I do only work for 3 days a week, so I have more days off, even though I'm here for long hours, but it gives me more days off. So it's definitely hard, but it's doable. It's always doable. You just have to make sure that you have like good support around you and family and friends, and it don't
think that when you became a mom, you kind of became like a different type of nurse too?
Yeah, for sure. It definitely changed me like emotionally and mentally. Maybe not physically per se, but definitely it made me a little bit kinder, I would say, just because you have
Yeah,
you have a
patient.
mom heart now, so it just changes your whole world. But yeah, I think it changed for the better. Yeah,
Good.
for sure. Yeah.
Did you do any clubs or organizations in undergraduate school or in school?
I didn't do a lot in school, but I'm part of a lot of things now in the hospital setting. So I'm a part of a bunch of councils and getting people together for events and holding kind of, we call them like lunch and learns, where you can get nurses to come and get a speaker, you get lunch provided and things like that. So I'm definitely part of a lot of that here in the hospital now that I'm out of school.
Yeah. Do you like working in the hospital environment?
I do.
Yeah.
Yes.
That's where I was thinking of going as well. Yeah.
I know, I mean, there's so many different things you can do, but I don't know, now that I'm in it and I've been in it for a while, I can't really see myself going anywhere else, which maybe I could and it would be fine. But I like where I'm at.
Good. Good.
Go private practice.
Do you?
Yes.
If it's your thing, then go for it. You know, everyone has their niche that they fit into. So you just gotta find what's good for you.
Every time I think of a hospital, I think of like Grey's Anatomy, and
Yeah.
I just
Oh,
feel
yeah.
like I could not do
I know.
stress levels.
Everything's like connected and
Yeah.
it's like a flow away.
Yeah. Yeah. Everyone's different.
So all of your work friends, like, do y'all hang out outside of?
Some of us do, yeah.
Some of us do.
Yeah. I mean, a lot of times you go and then you talk about work, which is silly. But you know, that's just I think with anything. But yeah, you make friends. You make good friends. Yeah.
Share similar
So it'll be
interests and
exciting.
stuff.
Yeah. Yep.
Are there any stigmas around hospitals that aren't true that you've realized?
Like she's
Working in
saying,
hospital.
like Grey's Anatomy,
Yeah.
it is like not like the TV show.
Yeah.
Like I watch Grey's Anatomy still. I've been watching it for like 10 plus years, and you'll see things on the show, and you're like, that is not real life. That is not what happens, you know, really in the hospital. So don't let it scare you away.
Okay.
Because it might not be totally true.
Oh, yeah.
Hi, it's Kelly. Hi.
Do you want to check this out?
Which one? Oh, so, well, I had them called in, and I texted her. She said she'd be here by 11, but I texted her to see if she'd come in early. I haven't heard back, so. Yeah. I think. Let's hope we can see you today, this morning. Yeah. I know, she said she wanted him up first, regardless, so. I'm gonna get him up too.
I want to stop and get food. Like,
I'll see ya.
okay, great.
Will do. Bye. Okay.
Perfect.
I think that's it.
Okay.
Thank you so much.
Okay.
Thank you so much
Yeah,
for
of
your
course,
advice.
of course. And if
Taking the time to
yeah, of
answer
course.
some questions.
Sorry, I got interrupted.
For our
but-
bio
so good.
Yeah. And if y'all need anything else, y'all know where to find me.